Cutaneous T-cell lymphomas, or CTCLS, are non-Hodgkin lymphomas that present in skin. The best studied CTCL subtypes are Mycosis fungoides, or MF, and Sézary syndrome, or SS. The involvement of blood in the staging of MF and SS has evolved from merely being present or absent to detailed assessment and quantification of the known phenotypes of neoplastic T-cells in these conditions. Neoplastic T-cells are now thought to be present in the circulation from the very early stages of MF and have been implicated in its pathogenesis from the formation of initial skin lesions to the seeding of subsequent lesions as the disease progresses. This, along with observed survival differences according to levels of blood involvement, has highlighted the importance of blood assessment as part of disease staging for MF and SS. Although international guidelines now recommend and include guidance for flow cytometric analysis of peripheral blood markers for disease staging purposes, many clinics only perform these analyses in advanced stage patients, if at all, and there is still a need for standardized use of validated markers. Consensus recommendations have now been published considering instances where the use of flow cytometry in MF and SS is especially appropriate, in centers where it may not be practical or possible to assess and track blood tumor burden for all patients. These include, for the first time, patients with intractable pruritus, lymphocytosis, or lack of response to treatment. Additionally, the sixth biomarker panel of CD3, CD4, CD7, CD8, CD26, and CD45 has been recommended as the minimum combination of antibodies to be included in a single 6-color assay for the assessment of blood tumor burden in MF and SS. In conclusion, standardization of a single effective multi-parameter flow cytometry panel and related protocols will ensure accurate identification and quantification of blood involvement in all cases of MF and SS, which is useful diagnostically and prognostically, as well as for monitoring for disease progression and assessing treatment response.